Welcome to Compassion Speaks. I'm your host, Ezra Borrego, where we give a voice to our nonprofits. Today on our show, we have Sandy Angelo, correct? From the Navajo Family Advocacy Center. Welcome today, Sandra. It's good to have you again.
Thank you. It's always fun to be here.
We have some interesting times going on, and we're going to talk about some things that are going on in the community with the Advocacy Center and some events coming up and how things are being dealt with the COVID-19.
Right. So anyway, for those who don't know, the Family Advocacy Center works in a multidisciplinary team environment, and what we do is we assist children who have been subject to physical or sexual abuse, who have been drug endangered, neglected, witnessed a serious crime. We provide forensic interviews, medical exams, advocacy, case management, mental health services, just anything to help the child get on the road to healing and to help get justice for the child. Because what we're doing with, for example, a forensic interview is talking to the child about what happened. And then that information is both watched by law enforcement, maybe the Department of Child Safety, possibly a prosecutor, and it's recorded. And that way the child only has to tell the story once. And that allows the child to not be re-traumatized. And one of the things we see during the forensic interview is as the child starts talking and telling, they start to visibly relax. And so we know that the healing is already starting because the child knows he or she is in a safe place and he or she is believed. And we continually tell them it is not their fault.
Right.
And those are key things to healing. The interview is recorded. It becomes part of the evidence stream, the data collection that hopefully becomes part of the evidence stream to allow for charging and ultimately prosecution, and hopefully some justice will be served.
Wow. So that you guys play a big part in that for that child, to make them feel that the guilt that they may have, the loneness they may have, and how scary this is, especially if it's a family member, that to be able to open up and talk to somebody, and somebody neutral, which is very, very important.
Well, and the conversation, it's a conversation more than like you would think an interview, ask a question, answer a question. It's a conversation. It's culturally appropriate, it's age appropriate, and because we also see very young or older children, and we see children who have disabilities of some sorts, cognitive disabilities, the conversation is adjusted to meet those special needs. And again, so the child feels welcome and safe. When you come into our center, it's like walking into a family room. We've had kids say to their parents, I want to go back there. I had a good time.
And they feel safe.
They feel safe. They feel cared for.
Wow.
And we give them all kinds of resources. And our goal is twofold. One, get the child on the road to healing. And the other part is to seek justice for that child.
Yeah. Wow. So you have people that are trained, I'm sure, to be able to have that conversation flow and to be able to have those children come out with things that you guys want to understand what's going on.
Right. Yes, and so Linda Kingery is the primary forensic interviewer, and she's really good. She's been specially trained. She's gone to a lot of classes. She goes to classes regularly to keep her skills tuned or honed, and then they also do something called peer reviews, where other forensic interviewers and law enforcement people, and sometimes the attorneys, participate. They review some of the tapes in a group and talk about how the interview went, what they might have done better. And so we're always trying to improve, again, because it's in the best interest of the child. You
bet, you bet. So when you get, who are the ones that call you? It could probably CPS, and who else are the ones that call you to be able to come in and to be able to be advocate for those children?
Okay, we don't do walk-ins.
Right.
And so our clientele come to us either through law enforcement or through the Department of Child Safety. And sometimes they come through NACASA, which is a program of North Country Health Care.
Right.
But it's always done through referrals. You can't just walk in and say, I need to talk to someone. If someone comes in and says that, we might question them to clarify what the need is and then direct them to the appropriate source.
So how important it is to have the advocate for these children besides those people that start off with the case? How much of a difference does that make, having one and not having one?
Well, an advocate is like an emotional support person, as well as they provide information about, signs to look for. Okay. Or here's a referral. It's, again, it's a special person to help that child feel safe, and they work with the child and the family to help that family understand what happened and to further protect the child. And, because sometimes you don't see that result of trauma until later.
Right.
A parent came in the other day and said, I need a referral for mental health services for my child. And then she said, my child wants a baseball bat to keep next to her bed. Okay, let me get that referral for you.
Doesn't want to play baseball in the middle of the night or anything like that, for
no,
sure.
The child is not feeling safe.
No, not at all. Wow. So tell me a little bit about MDT. What is the MDT Partners?
Okay, MDT stands for Multidisciplinary Team.
Okay.
It is a cohesive, collaborative, wide-ranging group. It's made up of members from law enforcement.
So what you just talked about, some of those people.
Prosecutors.
Okay.
DCS. The domestic violence shelters. Representatives from both Apache and Navajo County, mental health providers and medical providers.
Okay.
And that way, they'll talk about a case and someone might have more information to add to it, to build to it, or so-and-so needs assistance, well, I can help you there.
Right.
And the other way that it works is if something happens, like a call comes in the middle of the night, we can then call one of the resources and they just jump on it right away.
Wow. And
can, a mom walks in and sees something going on with her child, she grabs the child, her handbag, and runs, ends up at the police station. Well, okay, now we've got to put that person somewhere. And so suddenly the wheels are set in motion. The DV shelter is called, or the hospital is called, whatever makes the most sense. But we can get a plan put together in about an hour, or a little more than an hour, because everybody is just right there right away. It's really amazing to watch.
It sounds like all those teams work really well together for the sake of that child.
And we're all committed to children. Children are our future.
Right, you bet.
We need to make sure that as they grow up, because the statistics, like for example, 1 in 4 girls, 1 in 6 boys are going to be assaulted in some way.
Wow.
By the time they are 18. It's just incredible, the numbers. And what's even more scary is that 90% of the perpetrators are known to the child. They're a trusted person usually.
Yeah.
And that's, that violation of trust is what's so damaging to the child.
Yeah, I understand too. And tell me if I'm wrong or not. When a person is kidnapped, a child's kidnapped, usually it's that child knows that person a lot of times. Mm-hmm. It can be a divorced parent or whatever, or an uncle, or is that true? Is that those statistics pretty much up there with somebody that they know? Well,
we don't always. Yeah, we do know about kidnapping, but yeah, the child generally because a child won't go to a stranger.
Right.
We teach a child stranger danger, which is important.
Yeah.
But it's also important to teach a child, my body is private and special.
Yeah.
And I control my body.
Yeah. Very important.
And so anyway, I do have some statistics here, a little poster.
Okay.
These are numbers from our center.
Okay.
And they're from 2019.
Okay.
And you'll see that we have seen about, since we opened in 2011, we've seen over 1,400 victims.
Wow.
And people don't realize that the demographics are kind of interesting. Last year, 78% of our victims were white, 11% were Native, 8% were Hispanic, and 3% were others.
So do you go do a lot of, is this on the reservation statistics or off the reservation statistics?
These are off the reservation
Okay.
statistics because the reservations come under the Bureau of Indian Affairs,
Okay.
and hence the FBI.
And this is only Navajo, or is this both Navajo and Apache?
Navajo and Apache
Okay.
counties. We serve both because we're the only game in town.
Right.
Unless they want to go down to Gila County, where there's a center there. There's 22 centers in the state of Arizona.
Okay.
And in our center, 7 out of 10 of the children that we see have been sexually abused.
Wow.
Yeah, that's scary.
Wow.
And right now, 60% of the children that we see are below the poverty level, which means that we're also a qualifying charitable organization. And so when you pay your taxes and you can click the box that says, you know, I want my charitable donation to go someplace,
Right.
think of us.
Yeah. Yes. Yeah, we need to think about these kids.
You know.
I know we're going to take a break in a little bit.
Okay.
We're going to talk a little bit about before when we come back about some things that are happening, some
Okay.
events, and also how the COVID-19's affected some of these situations.
Okay, great.
All right. So we'll be back in just a little bit, and it's good to have you with us. And we'll be back with Sandra in a brief moment. Welcome back to Compassion Speaks. We're back here with Sandra Angelo from the Navajo County Advocacy Center. And we just talked about some of the other things that was going on and how you guys work, who works with you in multiple
Multidisciplinary team.
team. And that's a big group of different people which
It
you
is.
guys work together in harmony. You're on the same page helping these kids. So we're going to talk a little bit about what's happening in the last 3-4 months in all our world, in our community, is the COVID-19. How has that affected our children and our families at home with staying at home more often? I'm sure it made some effect.
Yes, well, as soon as we heard that, you know, we were going into self-isolation, we looked also at our protocol, our processes at the FAC, because it was not uncommon for a whole family to show up. You know, we had a nice playroom. We give them snacks and water. You know, it was like a party there.
Yeah.
But we couldn't have that many people there and guarantee the safety.
Right.
And so what we did was we rewrote the protocol and triaged how we would see
Okay.
children. You know, so we knew if it was immediate. Because if a child is abused, if they're less than 13, we have to see them within 72 hours
Okay.
of the event. Whereas if they're older than 13, we have a little more time. And so those children we'd see immediately, but we also needed to allow time to sanitize everything. We took all the plush toys out of our,
Okay.
you know, and so everything that we have now sitting out for children can easily be sanitized or disposed of.
Yeah.
We are limiting who comes into the center, the child that is to be interviewed and the non-offending parent. So again, we are limiting everybody's exposure.
Okay.
And, you know, we'll make exceptions, but at first we were putting out like late disclosures. That's when, you know, a child finally decides they're going to and it's been a year or two since an event, they're going to say something. And we had been putting those interviews out 2 weeks, and so now, but then we thought, well, you know, this is not good for anyone. So we started spacing them out, so there are no wait lists. You know, we see children, we just don't see 7 children at a time or do 6 interviews in a day anymore. You know, everything has to be spaced so that we can sanitize the area. We knew that when children were no longer away from the house where, you know, there are other safe places or people around, schools, churches, the libraries, you know, recreation centers. We knew that when you have high stress and you're in confined areas, those children are at greater risk.
Right. Makes sense.
And so we had moved into our, you know, COVID posturing, whatever, and we hadn't even been in that for a week, and we had 3 cases. It's like, okay, it's starting already. And then it got quiet. And you would, you know, but what everybody, because all of us in the FACs, we talk to one another.
Yeah.
And it's like, we know this stuff is going on, they're just not reporting it. Well, why are they not reporting it? Well, if you're being beaten on and you don't know where you're supposed to go and you don't know what resources, and you've got this pandemic bearing down on you and jobs are lost and, you know, tensions are high, are you going to report and end up on the street? You'd rather take your chances.
Right. Wow.
And so, but there are instances where, you know, like a non-offending family member can only take so much. And so as a part of all this talking, Senator Victoria Steele from Legislative District 9, I believe, 9 in the Tucson area, she formed or started a statewide initiative. And almost all the FACs, all the military bases, anyone, Department of Child Safety, anyone who has child focus is a part of this. And there is a Zoom meeting every 2 weeks. People talk about what they're doing. The campaign is called Keeping Kids Safe. It's an initiative, a public awareness initiative, and it's also encouraging people to say something so that the child can get help. And there are a number of different numbers that they can call. You know, if you know it's an emergency situation, you call 911. You can report to the Department of Child Safety, which is 1-888-SOS-CHILD, and I will make sure that these numbers are available.
Okay.
Child Help has a number you can text or call, and in fact I brought a little, and I'm going to give you some of these because you see people.
Okay.
This is a little shoe card, and we're trying to figure out how to get these out. Now there were food programs going on during, you know, the most intense part of the lockdown, and we wanted to put these in like the food distribution. The problem is if the abuser sees it, they're liable to set it off. So we're trying to find other ways. But there were 10,000 printed. We have about 1,000 of them in our center. We've been handing them out to attorneys, to law enforcement. I'm going to drop some off at the library. I bring them to every meeting that I go. Anyone who has kid contact. Because what this card does is it gives a text number or a phone number. Children have access to cell phones. If they need to talk to someone, chit chat, even if it's just, I don't feel comfortable right now, and somebody is there who can either talk to them and find out what's going on or help them get some resources. So that's really cool. And
that is pretty neat.
It's the childhelphotline.org. This is a national organization.
Okay. What do you think, Sandra, is the biggest thing that keeps a child from calling that you've experienced? Okay. The biggest fear, should I say?
It's fear. It's fear that they're going to end up in foster care. They'll be wrenched away from their family. It's fear that, you know, the perpetrator who, you know, is possibly the breadwinner in the family
Right.
is going to be removed from the house and the family's going to starve. It could be that the perpetrator says, now this is just between us. It's our own special secret.
Right.
But if you tell someone, it won't be special anymore. Or if you tell someone, I'm going to hurt your brother.
Right. Yeah.
And so it's fear. Or no one's going to believe you. You're a child. And, you know, that's why the most important thing you can say to a child is, thanks for telling me. I believe you. It's not your fault. Children can't make that decision.
No. You know, Mr. Rogers, I used to watch Mr. Rogers
I love
off and on.
Mr. Rogers.
You know, and how he would approach all that made the child feel so comfortable and so safe and want to be responsible to share things when they need to share things. So that's...
And that's what we try to do in some of our outreach and prevention, is to teach children who is safe, build a body safety circle. You know, so you know who you can tell. And part of the commitment of somebody in that safety circle is, I will believe you. Most kids aren't going to lie.
Right, right. So before we run out of time, let's get into, does this cost anybody anything?
Sorry.
It's okay.
I talk, I cough. I apologize.
It's okay.
All services are provided to the children and their family at no cost.
Okay.
Now, people say, how do you afford it? Well, I write grants, and so we have grants. We have fundraisers. Well, sometimes.
Do you have any coming up?
Yes, we
with
do,
this going
because
on?
we've canceled a number of fundraisers this year, but we do have our biggest fundraiser coming up, and it's our 8th annual Put It on the Tee for the FAC. Oh, and we accept donations, and donations can be goods or services or cash. We like cash.
Yeah.
And cash that's not attached to anything. But, you know, what I like about our community, if I have a need, I can put out like a help, please, and pretty soon that need is met.
Wow.
And it's wonderful,
awesome.
and that's what's special about living in the mountain.
Yeah.
And, you know, we work so well together, all the not-for-profits, and we, you know, here, I have this resource, and I have extra, do you need this? So we share. Anyway, Put It on the Tee for the FAC. It is our major, major, major fundraiser. This fundraiser generates 1/3 of our operating funds.
Wow, that's a lot.
It's a lot. And so we've got our fingers crossed that we're still going to be able to hold this.
So T as in golfing? Is that what you're talking about?
Yes.
Okay, and where's that going to be at?
Torreon Golf
okay.
Club. It's on September 19th.
Okay.
Shotgun start at 11 a.m. And then we have hopefully a live auction, silent auction items, raffles, 50/50s,
Wonderful.
a nice dinner. There's little golf contests that go on. I'm not a golfer. I apologize. I can't tell you much of anything other than I know what a mulligan is. And anyway, everything that we generate goes to the FAC.
Wonderful.
So we need sponsors, and we have different levels of sponsorship from $5,000 down to $250.
Okay.
And each of them gives you different things. Like a $5,000 sponsor means that everybody who comes in gets a sleeve of balls with your logo on
wow.
it. Is that cool or what?
That is pretty cool.
But, you know, everybody gets recognized and acknowledged. They get a poster on the golf course, or 2 or 3, depending on what level of sponsorship.
You bet.
But we also need donations for things that we can either raffle or, raffle or auction off. And so bigger items, whatever. We'd love to, if Shalom Motorsports would give us a UTV, that would be wonderful.
Awesome.
But I also need volunteers.
That was my next question.
I need volunteers for, we have things that go on the center, although those, we're kind of keeping those because we're 6 foot distancing and keeping people safe. But I need volunteers to help me get this fundraiser on the road.
Okay.
I'm only one little old lady. I need help. The chair of the event, she's my age too. So and so anyway.
You got a lot of spunk, both of you, I'm sure.
Yes, well, we need help. And so we need people to go out and talk to community members, businesses about maybe donating something or being a sponsor, but mostly raffle items. We'll need help putting baskets together and preparing signage, and then the day of the event, I'll need people to help me at the event. So there's lots of volunteer opportunity. It can be long-term commitment, short-term commitment, whatever.
Wonderful. So we're running out of time. What is the best way for people to get a hold of you to not only go to the center, but a phone number to be able to put this out to get those volunteers and sponsors?
Okay. We have, for the event, it's best to call me directly or contact me directly, and it is 928-532-6231.
Okay.
And throughout this time that I've been working at home, whatever, my phone rings both on my computer and in my cell.
Wow,
so
wonderful.
the calls are always answered.
Good.
Except after 10 o'clock at night and before 7 a.m. in the morning.
I don't blame you. Well, we talked about a lot of things today, and a lot of things that are happening in our community today with the COVID-19 and how things have been affected, and also especially to be able to have an advocate for these kids that are in our community. It's so important to be able to have these kids taken care of and somebody there for them to be comfortable. And this company here, this nonprofit company, our advocacy center here in Sholo, Arizona, is one wonderful company to be able to do that. And a lot of other companies that are helping you guys out to do this.
Well, and last month you had Maria Stokes. She and I share stuff all the time,
awesome.
And other organizations, the Safe House, the Living Hope, we all work together because we understand that collectively we can do more.
Make a big difference.
And the other thing is, if you see something, say something.
Yeah. Well, thanks again, Sandra, and thank you for joining us today. And make sure you get out and serve your community. Tune in next month to see Compassion Speaks. Thanks again, Sandra.
Thank you.